you very much again to Milk for inviting me and to share a little bit about the advocacy work that's taking place in South Africa. I'm going to be giving you a little bit of a background in terms of or let me just say, I took this picture because I found it very, very intriguing. And it's the kind of message we're trying to get across with our project. It's about this undue influence of the formula industry. And it is an advocacy campaign. So firstly, I have no conflict of interest. I've received no incentive for presenting here. And I'm going to be pulling on some of the information from the project, which is the Infant and Young Child Feeding Advocacy Project. I'm no longer with the University of the Western Cape. I've moved to Wits. So I'm now the lead on the technical working group. So the actual project still sits with the University of the Western Cape, and I'm providing technical support and oversight with the technical working group. So I just want to make that clear. It's a little bit about our landscape in South Africa, and then looking at the drivers, particularly from this perspective of industry influence and interference. And then what are how can we counteract industry influence and interference in academia specifically, and why we're looking at academia, and then what will it take to build this breastfeeding culture in all our settings. On the cover of this particular slide is the report, which was part of the WHO 8-country study. This is the report for South Africa. And the South African report raised two issues. One was that the public sector was doing very well, but our private sector was not doing well at all. And that's where industry was getting traction and particularly engaging directly with our health professionals and academia. So this is our data that we have, a bit outdated, but it's the last demographic and health survey that was held in 2016. And I just draw your attention to the blue line, which is the exclusive breastfeeding line. Even though our exclusive breastfeeding rates have increased since the last DHS, which was in 2008, we see that still our exclusive breastfeeding rates start fairly high, 44%, and then it drops significantly by 2 to 3 months. This window of opportunity is when moms are still in contact with the health system, still getting a lot of support from the health system, and then it dwindles down to the point that currently South Africa's exclusive breastfeeding rates is only about 1 in 3, so around about 32% of our children under 6 months are exclusively breastfed. And we still have a significantly higher number of children that are exclusively formula fed. 1 in 4 children exclusively formula fed. That's despite us having a big program around the prevention of mother-to-child transmission. So it's not about HIV/AIDS. It's actually that formula feeding in South Africa is also aspirational. So now, despite all of these interventions that we have to actually improve breastfeeding and particularly exclusive breastfeeding, we have the industry that has already predicted by 2027. This is data that was put out in 2019. It shows that South Africa is projected to make profits around the formula industry all the way into 2027. So it begs the question, the expansion of formula is at the expense of what? We need to start thinking in terms of our government interventions as well as our civil society interventions. If the industry can be so bold to put out a prediction of profits, it means that it has to minimize or curtail the breastfeeding agenda, which means that we are losing moms to formula. And therefore, we need to understand how formula industry is working. So in this work that we're doing with the advocacy project, one of the things that we have come across is that in conversations and in discussion with our academics, there is this idea that they are untainted, that they are not influenced by the industry, yet industry is reaching out in many different formats. And there's no acknowledgement that it is coming at a cost and that there is no free lunch as we talk. And this cost is actually at the cost of children's health in the context of our child nutrition agenda. There's an increase in childhood obesity, as well as still a third of our children don't have access to clean water, don't have access to all the resources to optimally formula feed. So those children that are exposed to formula feeding are at risk of increased morbidity and mortality. And so this understanding that while we fraternize with the industry and we're allowing it to influence our decisions, it is coming at children's health. So we try to engage our academics by showing the links that this is not a new issue, that we've known as early as the 80s, that the infant formula industry and academia have had a very close relationship. And so from this article, the American Journal of Clinical Nutrition, it says that 4 decades past, which means in the 1940s already, industry was engaged with academia and building this relationship with academia, positioning themselves as friends of academia. And those academics, both in research and teaching and learning, are also influencing the next generation of practitioners. And there's this longevity in terms of industry's interplay with academia. Sorry. So now to jump directly to South Africa. So in 2012, there was a report. It was called the Nestlé Mapping Report, the Sahara Salt Report. And this report basically focused on the stakeholder that Nestlé itself had identified as priority areas to engage. So we had the multilaterals, and up there you see science and academia were already identified as a key entry point. And within this academic grouping, there's this concept called the echo chamber. So by influencing science and academia, the industry was able to, one, amplify as well as build credibility to influence professional organizations, healthcare professionals as a body, and then ultimately consumers. And so this is one of the pieces of evidence that we had that showed that industry was very strategic in engagement with science and academia. Now in South Africa, we have a regulation. We're all aware of the code. South Africa has taken the code and in 2012 had regulated the code under the Food Act. So we actually have got very strong legal framework for controlling the marketing of foods and for children and to children, and specifically formula. And within this code, we have a number of areas that have been identified where industry is engaging with academia. It is in terms of advertising and where they may advertise. It's about donations and distribution, including equipment, buildings, any sort of contribution towards infrastructure where we may be working with pregnant women, mothers, and children. Research grants and financial assistance, which would include bursaries, it would include scholarships, as well as lectureship, where the industry is paying for lectures in the field of infant and young child feeding. Financial contributions for conferences, meetings, anything like a CPD activity. These are all prohibited under the regulations R991. Yet, and I've circled the date, the regulations have been in place since 2012, which is more than a decade. But we had an incident in 2021 where a company like Nestlé advertised its opportunities to engage with mothers and babies around what we call stokvel. It's a local term, which is basically for a conversation. And this term is also misappropriation because it is a term that is used particularly in low-income groups for strategies to cope with maybe high price increases or not enough economic power. And so mothers would group together, pull their resources together to be able to buy food. And so Nestlé used this term stokvel to position itself to actually engage with moms around conversations about how to feed your children. And it was particularly insensitive. It was picked up in the media because, one, it was during COVID, and so there was a lot of food shortages. There was not enough money at household levels, and so hunger was at its highest. And here we have a multinational company coming on board to try and engage mothers, particularly to sell their products. And so this was picked up in the media, and the media, as well as activists, actually put a stop to these engagements by the formula company, not because of the regulations, but rather because of the insensitivities and how it was positioned, or how Nestlé positioned their conversations. Then later on in the year, we also had a high-level academic who was appointed to the board of Nestlé. Again, this was taken up by academics expressing concern and writing an open letter to the university, an open letter to all, a network of academics to try and have this academic step down from the board. Ultimately, that didn't happen in the academic space. And so again, it was taken to the media, and the media picked it up and tried to expose this conflict of interest that is happening in academia, and specifically academics that are working in infant and young child feeding or infant and young child nutrition. And so it again took the public to bring academia to its senses, and that particular academic has since vacated her post, still on the board, but then vacated her post. So these are all examples of how academics and academia are being influenced and where industry is interfering. It's unfortunate that it's one particular company that has been highlighted in these examples, but it's happening across the board, whether that's from just infant formula all the way through to foods targeting children. And so what we've really tried to do, I haven't presented data from this particular study, but through the project, we have gone and talked to academia, and there are a few things that are of concern. The first one is that academics feel that the industry can be trusted and therefore rely on the industry for information. And so we actually have to create awareness and raise alarm bells for at every incident or every contact point. It's not always in health research or in nutrition research, but we find that the industry is also coming through the entry points of early childhood development, what we call indigenous knowledge. So there are other entry points there where you may not have enlightened academia. And so we have to start raising these alarm bells. We also found that academics themselves don't have structures or processes in place to regulate the formula industry. They are open to taking, obviously, all universities need to raise funds and are looking for funds. And often it's the industry that is approaching the institutions, and the institutions don't actually have instruments that can control or regulate how the industry is engaging with them. And then finally, we are working directly with young academics, student bodies, to try and be proactive and try and get academics to start discussing this even during student training, and making it an active part of student advocacy and student understanding of social justice issues by having a monitoring and a pro-incident kind of approach, not to respond once there's been a violation of the regulation, but actually for academics and young students to be aware of the potential of conflict of interest, the potential of undue influence, because we know that most people don't see this as part of the marketing of infant formula. They actually do see it as a service or a contribution by the formula companies to academia. And so we need to unmask this. Oopsie, sorry. So while we were doing this work, we were very happy and grateful that the reports from WHO had come out early 2022, which was last year. And then this year we had the Lancet series on breastfeeding that also raised these issues about the conflict of interest. And later we had the commercial determinants of health, which all talk to these issues of conflict of interest and putting up the guardrails for how academics engage with the industry. Thank you.